Okay, to begin our lecture, this is a series of lectures on pathology, and we will start with introduction to the subject, how to approach pathology as a subject. That is fine. See, in pathology, we need four things. Okay, we need four things to know to understand someone's pathology. Let's say if I said myocardial infarction, so I need four things to know about myocardial infarction in the paradigm of pathology. That is our introduction. How to approach this subject. The first thing I would like you to know that the first thing we need to know in pathology is the cause. Is simply the cause. In scientific terminology, or the other word is etiology. Okay. What is the cause of something, some disease or disorder to happen? That is our first priority. Okay, we need to know this. The next thing which we are concerned about is that is pathogenesis. Pathogenesis, how the disease occurs. Okay, all the molecular, physiological parameter, how the disease will occur inside the body. The third is morphological changes. Morphological changes of any disease. It also comes under pathology. We will study morphological changes also. And the last is clinical manifestations. Okay. These are the four things which we need to know about pathology. First is pathology of a disease. If I ask you a pathology about MI, so you need to tell me four things. First is what is the cause of myocardial infarction. The next is how the myocardial infarction will occur, also known as pathogenesis. What are the morphological changes I would witness in a myocardial infarction patient? And what are the clinical presentations, or what would be the clinical manifestation of a myocardial infarction patient? He will come with a chest pain. So, chest pain would be clinical manifestation of a MI patient. So, in causes, the causes can be of two types. In any pathology, causes can be of generally two types. First is genetic cause. Genetic causes are those which are due to DNA mutation or anything in genetic material. Most common is mutations. The other cause which are not by birth, or which are not congenital, or which are not genetic, or which are not due to mutation, all the other causes are acquired. That is to mean you acquire them in your life. Okay. So this may be like infections, or mutations can happen in acquired also. Okay. The other will be nutrition defect. If there is some deficiency or something like toxicity, it will be an acquired cause to a disease which will happen next. So basically, we got two headings here in causes and etiology. We are going to classify into these two. The pathogenesis. What in pathogenesis? Let's say this is an injury or trauma or stress, whatever you want to say it. If after an injury, what are the cellular changes at the changes which occur at the level of cell? What are the cellular changes and biochemical changes in the cell itself, or in bigger scenario, biochemical changes? And what are the molecular changes? Molecular changes are generally in the feedback mechanism due to some pathology. Okay, molecular changes. All these three changes come under the pathogenesis. When we learn some pathogenesis of a disease, we discuss the disease or the pathogenesis under these three headings: cellular changes, biochemical changes, and molecular changes. How can I simplify it? Okay, let's take an example of a disease called cystic fibrosis. Cystic fibrosis. What does the name tells you? Cystic means cyst. Fibrosis means fibrosis. Okay, that is simple. Where is the cyst? Where is the fibrosis? The site is actually lung. Okay. What is the cause? Okay, we will start with the first heading. No? What is the cause? Cause is genetic. I will not get into the detail. It is actually F508 mutation. And what are the cellular changes, what are the biochemical changes, and what are the molecular changes, we will discuss here. Then what will happen? The lung will undergo fibrosis. And if I take out the lung and if I see the lung, that will be its morphological change. That would be third heading, morphological. And what will be the clinical manifestation? Okay, fourth step is clinical manifestation, which I already told you. The lung will be damaged. Lung fibrosis leading to dyspnea, cough, or other features. How a lung, how the lung will present. But cystic fibrosis is a systemic disorder, so other organs can be impacted, will be impacted actually. So other many a long list of features are there. So that's how we discuss a disease under the heading of pathology. That's how we learn pathology about any disease. The third heading is morphological changes, which is simpler terms, structural changes due to a disease. See, structural changes, why are we discussing them is we have only two purposes. First the structural changes which we need to study are they must be characteristic of that disease, and it will help in diagnosis. I am writing triangle, okay. Diagnosis. Our main aim is to diagnose the disease. So we will study the structure and of various diseases. So when we see them in our clinic or in biopsy samples or any place else, we can diagnose them, and in relevance to that, we can treat them. The last is clinical manifestation. These are the things which the patient will present in history of the patient. When the patient presents to you in clinics, here you can find these features. But this is the sequence of any disease. There is a cause, there is a pathogenesis, and you will see morphological changes, or maybe you don't see morphological changes, and it will manifest in clinics. That is the introduction to pathology. Thank you. We will discuss next topic in next video.